Hey everybody, Dr. Shikari here. When do we recommend cervical disc replacement surgery? Well, you have to be somebody who obviously has significant disc pathology, and also it should be somebody who is relatively young, because as we age, the spine becomes more arthritic, and as the spine becomes more arthritic, disc replacement becomes less successful in maintaining the motion of the spine at whatever segment the patient is having surgery. So it has to be somebody who's relatively young. So typically it would be somebody in their 40s or younger who has a disc problem that requires surgery through the front of the neck. And in that situation, disc replacement is often better than doing a fusion, because it seems to stress the rest of the spine less so than a disc replacement fusion would do. So in most cases, a fusion is reasonable, it's adequate, it's the right call, but there can be situations, particularly in the young, when you have a soft disc herniation that needs surgery, then a disc replacement surgery may be the better option. Have a nice day.